Welcome to the Dr. Izzy's Medical Podcast channel.
Question: What type of hypersensitivity is associated with pemphigus vulgaris? Answer: Type 2. Question: What type of hypersensitivity is associated with pernicious anemia? Answer: Type 2. Question: What type of hypersensitivity is associated with polyarteritis nodosa? Answer: Type 3. Question: What type of hypersensitivity is associated with post-streptococcal glomerulonephritis? Answer: Type 3. Question: What type of hypersensitivity is associated with PPE test for tuberculosis? Answer: Type 4. Question: What type of hypersensitivity is associated with rheumatic fever? Answer: Type 2. Question: What type of hypersensitivity is associated with serum sickness? Answer: Type 3. Question: What type of hypersensitivity is associated with SLE? Answer: Type 3. Question: What type of hypersensitivity is associated with vasculitis and systemic manifestations? Answer: Type 3. Question: What type of hypersensitivity is involved in acute hemolytic transfusion reactions? Answer: Type 2. Question: What type of hypersensitivity is involved in febrile non-hemolytic transfusion reactions? Answer: Type 2 hypersensitivity. Question: What type of lymphocyte is affected in chronic mucocutaneous candidiasis? Answer: T cells. Question: What type of lymphocyte is affected in Job syndrome? Answer: T cells. Question: What type of lymphocytes are affected in severe combined immunodeficiency? Answer: T and B cells. Question: Where are acute phase reactants made? Answer: liver. Question: Which anti-inflammatory cytokines are produced by regulatory T cells? Answer: IL-10, TGF-beta. Question: Which area of the lymph node enlarges in extreme cellular immune responses? Answer: paracortex. Question: Which area of the lymph nodes are not well developed in patients with DiGeorge syndrome? Answer: paracortex. Question: Which autoantibody is associated with antiphospholipid syndrome? Answer: anticardiolipin. Question: Which autoantibody is associated with autoimmune hepatitis? Answer: anti-smooth muscle. Question: Which autoantibody is associated with bullous pemphigoid? Answer: anti-hemidesmosome. Question: Which autoantibody is associated with celiac disease? Answer: IgA anti-tissue transglutaminase, IgA anti-endomysial. Question: Which autoantibody is associated with Churg-Strauss syndrome? Answer: p-ANCA. Question: Which autoantibody is associated with diffuse scleroderma? Answer: anti-SCL70. Question: Which autoantibody is associated with drug-induced SLE? Answer: antihistin. Question: Which autoantibody is associated with Goodpasture syndrome? Answer: anti-basement membrane. Question: Which autoantibody is associated with Graves' disease? Answer: anti-TSH receptor. Question: Which autoantibody is associated with Hashimoto thyroiditis? Answer: antimicrosomal, antithyroglobulin. Question: Which autoantibody is associated with limited scleroderma? Answer: anticentromere. Question: Which autoantibody is associated with microscopic polyangiitis? Answer: P&CA or MPO and CA. Question: Which autoantibody is associated with mixed connective tissue disease? Answer: ribonucleoprotein. Question: Which autoantibody is associated with myasthenia gravis? Answer: anti-ACE receptor. Question: Which autoantibody is associated with pemphigus vulgaris? Answer: anti-desmoglein. Question: Which autoantibody is associated with poliomyositis and dermatomyositis? Answer: anti-Jo1, anti-SRP, anti-Me2. Question: Which autoantibody is associated with primary biliary cirrhosis? Answer: antimitochondrial. Question: Which autoantibody is associated with rheumatoid arthritis? Answer: rheumatoid factor, I'm specific to the FC region of IG, anti-CCP. Question: Which autoantibody is associated with Sjögren syndrome? Answer: anti-SSA, anti-SSB. Question: Which autoantibody is associated with SLE? Answer: anticardiolipin, anti-DSNA, anti-Smith, ANA. Question: Which autoantibody is associated with T1DM? Answer: anti-glutamate decarboxylase. Question: Which autoantibody is associated with Wegener granulomatosis? Answer: c-ANCA. Question: which cell surface protein is defective in hyper-IgM syndrome? Answer, CD40L on Th cells. Question, which cell surface protein on macrophages is the receptor for endotoxin LPs from gram-negative bacteria? Answer, CD14. Question, which cell surface protein on natural killer cells binds to the Fc portion of IgG? Answer, CD16. Question, which cell surface protein on NK cells is a unique marker for natural killer cells? Answer, CD56. Question, which cell surface receptor on B cells binds to CD40L on helper T cells during B cell activation? Answer, CD40. Question, which cell surface receptor on B cells is the receptor for Epstein-Barr virus? Answer, CD21. Question, which cell surface receptor on T cells binds to B7 on APCs during the secondary signal in T cell activation? Answer, CD28. Question, which cell surface receptor on T cells binds to the antigen MHC complex? Answer, TCR. Question, which cell surface receptor on T cells is associated with the TCR for signal transduction? Answer, CD3. Question, which cell type is the only cell that does not have MHC1 on its surface? Answer, mature RBCs. Question, which complement disorder increases the susceptibility to type 3 hypersensitivity reactions? Answer, C3 deficiency. Question, which complement pathway is activated by Ig or IgM? Answer, classical. Question, which complement pathway is activated by mannose or other sugars on the microbe surface? Answer, lectin. Question, which complement pathway is activated by surface molecules on microbes? Answer, alternative. Question, which complement protein disorder causes hereditary angioedema? Answer, C1 esterase inhibitor deficiency. Question, which complement protein is involved with neutrophil chemotaxis? Answer, C5a. Question, which complement protein is involved with opsonization? Answer, Seb. Question, which complement protein is one of the two primary opsonins in bacterial defense? Answer, Seb. Question, which complement proteins are involved in anaphylaxis? Answer, CEA, C4a, C5a. Question, which complement proteins are involved in the formation of the MAC? Answer, C5b, C6, C7, C8, C9. Question, which cytokine from macrophages functions to stimulate T cell differentiation into Th1 cells? Answer, IL-12. Question, which cytokine from Th1 cells functions to activate macrophages? Answer, IFN gamma. Question, which cytokine induces the differentiation of helper T cells into regulatory T cells? Answer, TGF beta. Question, which cytokine induces the differentiation of helper T cells into Th1 cells? Answer, IL-12. Question, which cytokine induces the differentiation of helper T cells into Th17 cells? Answer, TGF beta plus IL-6. Question, which cytokine induces the differentiation of helper T cells into Th2 cells? Answer, IL-4. Question, which cytokine released by macrophages activates NK cells? Answer, IL-12. Question, which cytokine released by macrophages mediates septic shock? Answer, TNF-alpha. Question, which cytokine released from all T cells functions to support the growth and differentiation of bone marrow stem cells? Answer, IL-3. Question, which cytokine released from macrophages causes fever and stimulates the production of acute phase proteins? Answer, IL-6. Question, which cytokine released from macrophages functions as an endogenous pyrogen, causing fever and acute inflammation? Answer, IL-1. Question, which cytokine released from macrophages functions to activate endothelium to express adhesion molecules? Answer, IL-1. Question, which cytokine released from macrophages functions to induce chemokine secretion to recruit leukocytes? Answer, IL-1. Question, which cytokine released from macrophages induces the differentiation of T cells to Th1 cells? Answer, IL-12. Question, which cytokine released from macrophages is a major chemotactic factor for neutrophils? Answer, IL-8. Question, which cytokine released from macrophages is also called osteoclast activating factor? Answer, IL-1. Question, which cytokine released from Th1 cells functions to increase MHC expression and antigen presentation in all cells? Answer, IFN gamma. Question, which cytokine released from Th1 cells has antiviral and anti-tumor properties? Answer, IFN gamma. Question, which cytokine released from Th2 cells functions to induce differentiation into Th2 cells? Answer, IL-4. Question, which cytokine released from Th2 cells functions to promote B-cell differentiation and enhance class switching to IgA? Answer, IL-5. Question, which cytokine released from Th2 cells functions to promote B-cell growth and enhance class switching to IgA and IgG? Answer, IL-4. Question, which cytokine released from Th2 cells functions to stimulate the growth and differentiation of eosinophils? Answer, IL-5. Question, which cytokine secreted by all T cells stimulates the growth of all T cells? Answer, IL-2. Question, which embryological pharyngeal pouch gives rise to the thymus? Answer, epithelium of the third pharyngeal pouch. Question, which flow cytometry test is abnormal in chronic granulomatous disease? Answer, abnormal dihydrorhodamine test. Question, which fragment in antibodies contains both the heavy and light chains? Answer, Fab. Question, which fragment in antibodies contains the heavy chain only? Answer, FC. Question, which fragment in antibodies determines the idiotype? Answer, Fab. Question, which fragment in antibodies functions to bind antigen? Answer, Fab. Question, which fragment in antibodies is involved with complement binding? Answer, FC. Question, which fragment of antibodies determines the isotype? Answer, FC. Question, which gene is defective in Bruton-agammaglobulinemia? Answer, Bruton's tyrosine kinase, results in a lack of B-cell maturation. Question, which gene mutation is seen in Job syndrome? Answer, STAT3, causes a deficiency of Th17 cells which leads to impaired recruitment of neutrophils to sites of infection. Question, which genetic defect is seen in Chiari-Akagashi syndrome? Answer, least, lysosomal trafficking regulator gene. Question, which gram-positive bacterial genuses often cause recurrent pyogenic infections in Chiari-Akagashi syndrome? Answer, Staphylococci, Streptococci. Question, which HLA subtype is associated with ankylosing spondylitis? Answer, HLA-B27. Question, which HLA subtype is associated with celiac disease? Answer, HLA-DQ2 and DQ8. Question, which HLA subtype is associated with Goodpasture syndrome? Answer, HLA-DR2. Question, which HLA subtype is associated with Graves' disease? Answer, HLS-DR3. Question, which HLA subtype is associated with Hashimoto thyroiditis? Answer, HLA-DR5. Question, which HLA subtype is associated with hay fever? Answer, HLA-DR2. Question, which HLA subtype is associated with hemochromatosis? Answer, HLA-A3. Question, which HLA subtype is associated with multiple sclerosis? Answer, HLA-DR2. Question, which HLA subtype is associated with pernicious anemia? Answer, HLA-DR5.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.